Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a program director, internal medicine residency, and also an associate professor of medicine. Today we're going to continue our teaching to teach you everything about in-service training topic, which people usually miss and they fail. And you don't want to be that person, right? You want to score really well. So all your career is like a rocket. Wherever your dream is going to get faster. So let's talk about today. Our is diagnosing acute cholecystitis, okay? When you talk about cholecystitis, before I say anything, you need to express this in numbers. Everything I said, when you can express in number, that means you know the situation. So one number I want you to remember is the gallbladder wall thickening. That is, the normal is 4. Remember, 4. That number, you have to put it in your mind before and you talk about cholecystitis. Okay? Normal gallbladder wall thickening is 4 millimeter. Anything above that is abnormal. Okay? That number, now next move over. There are some initial clinical suspicion. Of course, they're going to come with the right upper quadrant tenderness, pain, mass not very likely, but usually right upper quadrant pain and tenderness. You do the Murphy sign, ask them to take a deep breath and you push it in. They're going to have pain. Systemic signs of inflammation. They could have fever, elevated WBC count 11,000 and elevated CRP. So if you have one of this and one of this, what does that mean? You are suspecting acute cholecystitis, okay? So once you suspect it, then we have to go for the best test available. We need to find out what's the first thing we have to do. We have to look at the test. So a lot of people, I think everybody get confused when it comes to the imaging. The number one test you do, it is right abdominal ultrasound. The sensitivity and specificity is much higher compared to the CT scan. So don't make the mistake of doing a CT scan. Okay? Even if your CT scan come back negative, your suspicion is high, go for our abdominal ultrasound. So if the examination question comes in, you got two choices, abdominal ultrasound, CT scan, which one you will pick?
Abdominal ultrasound.
Abdominal ultrasound, okay? And then again, we talk about the numbers. Gallbladder wall thickening greater than 4 millimeter, okay? Now, pericholecystic fluid. Those are the two classic findings you will see. And then sonographic Murphy sign, not the regular Murphy sign. This one had a highest likelihood ratio, okay? So sonographic Murphy sign is the person who's doing the ultrasound, put the gel, and they use that thing and they try to push it in, and sonographic Murphy sign positive. You got a ratio of 4.8. That means your odds have gone up like 20-25% higher. This person can have it. The pretest probability will go up really high. Now, if it is inconclusive, the next best test is the HIDA scan, which are the highest sensitivity and specificity. But you don't jump into this one right away, okay? You always do the abdominal ultrasound, then you do the HIDA, which is greater than 95% sensitivity and specificity. So think about all this. So these are the findings when they do abdominal ultrasound is important. The one thing to remember, 4 millimeter gallbladder wall, that is the thickening, the normal thickening. If it is greater than 4, there is gallbladder wall thickening consistent with the cholecystitis. You're going to have pericholecystic fluid, and then in your diagnosis there. If it is inconclusive, then you do the HIDA scan, which sensitivity and specificity is extremely high. Simple topic, but please try to remember one number up here for me. Gallbladder wall usual thickening is around 4 millimeter, okay? Anything above 4 is bad. That could be acute cholecystitis. Positive sonographic Murphy sign, you got a likelihood ratio. Read that number for me.
4.8.
Yeah, so your odds of like pretest probability go at least 15 to 20% higher. Thank you so much for watching. We have made 5 board review questions for you. Please read that carefully, answer it. Then you look at the answer. If you don't understand it, come back and review our thing. Please continue to support. We wanted to make a lot more videos. Without your support, it's not possible. But make sure you watch the videos. You will do extremely well, I promise you, in the in-service training exam. Okay? Thank you very much and God bless.